My name is Amar Patel. I'm the director for the Center for Innovative Learning at WakeMed Health and Hospitals. So for me, it started off in 2000. Kind of got recruited 2000 and 2001. Got recruited to do simulation work with the University of Maryland, the Maryland Fire and Rescue Institute, and kind of from there, it snowballed. It started off as a small project doing mobile simulation, and over the years we started working more and more with simulation products there, taking it around the state. And about 4 years ago, got asked to kind of oversee a simulation program at WakeMed and kind of develop from the ground up. So something different, something new, something unique. My focus has always been pre-hospital and EMS, and this was great to be able to do multidisciplinary and do kind of an operational side as opposed to kind of a little bit of everything. And so over the last 10 years, it's come substantially a long way for me as well. So it's been really nice to see that transition and really nice to make an impact in the programs. Me, I would love to be able to do more. We have 8,000 people on the campus on any given day, and so be able to touch all 8,000 people would be fantastic. And at the moment, we only touch 4,000 people a year. And also be able to touch, love to do more military work. That's a passion of mine. Be able to touch more EMS and pre-hospital providers than we already touch. I really see me doing anything and everything that I can think of. That's our program is really focused on touching the lives of anybody that asks for our assistance, and so being able to expand upon that tenfold would be great. I wanted to do something crazy, and that was one of the things when they came to me and said, hey, we'd love for you to try to do the opening session. I wanted to do something that I had a lot of experience with, something that really motivated me and something that hit home. And my background is all EMS and flight medicine and firefighting. And so I wanted to do something that really encompassed the EMS scenario, but I also wanted that multidisciplinary approach. I wanted to be able to incorporate all levels of a healthcare system so that people can understand the value of simulation, no matter what level you are, whether you're the beginner, whether you're the pre-hospital provider. It's that simulation is all about a systems approach to education. And so for me, I wanted to be able to encompass that. So thinking outside the box, I thought through calls that I'd been on, things that I had done in my career, and things that are important to highlight for people to see the value of simulation. And the scenario that we came up with in the opening session was that scenario. So what we wanted to be able to do is encompass the 911 phone call, the pre-hospital response, the air medical response, and then ultimately the hospital care and management. The key points that we highlighted in this scenario were all the providers and responders working together as a cohesive team in order for us to take care of a patient. So the brief snippet on the scenario was an opening video that involved somebody calling 911 and working with the dispatcher to be able to get instructions on taking care of somebody and getting more information for the pre-hospital folks to arrive. At the end of the dispatch, you hear an ambulance coming on scene, you see the EMS crew arrive, you see a bystander sitting in the middle of the stage asking for help, trying to guide the EMS providers to where she's located. They arrive, they start taking care of the patient, they solicit more information from the bystander. The air medical crew arrives because they realize that the trauma center is too far away and they need more help because it's just them and a bystander. Air medical crew arrives and they work together as a team to take care of the patient and ultimately transport it to the trauma center. At the arrival of the trauma center, there's this pass-on of information, and then the trauma doctor, or the emergency room physician in this case, as well as the rest of the trauma team that's there, takes care of the patient, ultimately stabilizes him, and then transfers him out. So how much planning was involved in developing that scenario? I think there was a significant amount of planning. Developing an opening session scenario for us, it's a lot of work because not only do you have to write the script, you have to figure out, okay, so who's going to be your actors? And you have to think through what types of equipment do you need? How many people do you need to be there? Who needs to be moulaged? And we're trying to make this medically appropriate. So what type of medical appropriate stuff? Like the small things matter in simulation. If your staff aren't wearing gloves in simulation, then when they go to the bedside, in their brain, it doesn't always click that they're supposed to put on gloves. So for instance, making sure that they're putting on the trauma gear, the gloves, the masks, because you have to protect yourself. If it's an EMS response, who's going to wear a flight suit? Right? Or is that the normal gear that they wear? Do we have stethoscopes to do our assessment? So there's a lot of equipment stuff. There's a lot of personnel responsibilities that need to take place. There's a lot of logistics. So a significant amount of planning, but in the end it pays off. It's an invaluable process. And for me, the planning piece that was fantastic was adding this little creating what we call a hybrid simulation, where you're ultimately adding video clips and audio clips and making not only the audience feel like they're immersed, but making yourself immersed in the situation. You know, for us, we got lost in the environment and we knew the scenario from the beginning. So that was what made it all worth it. I don't think I would have done anything differently, to be honest. To do things differently means that the entire scenario would have completely changed its purpose. I think I wouldn't have done anything differently. What would I have done better? You know, hindsight being 20/20, as the flight paramedic taking care of the patient, I would have taken care of the patient differently. But other than that, yeah, I think it would have been fantastic. Can you design a perfect scenario? I'm not quite sure you can ever design a perfect scenario. You know, in this particular case, we knew, all of us as professionals knew what the scenario was, but the highlighting purpose of that particular scenario was making sure that the response profiles got taken care of. And then in the back of our mind, making sure that we met certain checklists. The key to the EMS response was communication. And in this particular case, you know, one of the biggest monkey wrenches was there enough communication, and how do we make enough communication, and then who's in charge of that scene? So one of the biggest things you saw with that incident was some people felt like I as the air medical provider was in charge, and some people felt like the EMS provider was in charge. So big monkey wrench, communication's the key to success. So I think that was one of the biggest things that we had designed purposely into the program, was who was really in charge and how do you establish that person being in charge. As for the in-hospital section, the design of that scenario was purposeful in that we make sure that the patient gets taken care of. However, you'll notice halfway through the scenario that the doctor stops listening to people, right? It's important that communication play a role in it. And we see it every day in trauma centers across the world. We see it every day in patient care management. We're so focused on a specific area that we completely block out everyone around us. And we designed it such that the doctor is there, he's hearing you. You know, Graham is paying attention to what's going on, but doesn't necessarily hear you. And are people more forceful? Are they more aggressive? Will they listen to you? If we designed, and in this case, the patient went into cardiac arrest because we missed something, right? And the staff around him told him very clear, this is the thing, but are you being aggressive? Are you being forceful? Are you saying, Doc, listen to me? And so that communication is important, and that scenario was designed as such. And you'll see him step back, and ultimately the light bulb will come on, and he'll realize that, yeah, staff are right. There is something wrong that's going on with the patient. The debrief is more important than the actual scenario. The debrief, to me, is the most valuable portion of the entire program. It really sets the stage for where learning can occur. The unique thing with simulation experiences is it provides us with a little bit of cognitive understanding of the providers and the application of their skill. Debrief allows you to sit down, pose a question, and really understand where an individual's gaps exist. And without that discussion, we would continue to make mistakes. If you allow for reflection to happen during that debrief process, then students will have that aha moment and realize that I'm not perfect, we're not perfect, the program's not perfect, but in the end, they ponder, they think, and if you put that question in their mind, they're going to go back, they're going to look it up, and they're going to apply it later on. And they're going to, in the end, our job is to make people safer, and they're going to do that. So debrief is more important than the actual simulation experience. The simulation experience is only one very small piece to the entire puzzle that exists.